record. Okay. So it is Thursday the 7th. They have not updated yet today the COVID numbers yet, but there were 0 cases yesterday. And so that definitely that trend seems to be going down. And there's some new mandates going into effect here on I think on Friday. And what I had read is that they are going to go to 50% capacity, like for restaurants, apparently 25% capacity for bars, fitness centers, theater, potentially the library. As a city council member, I have not heard anything about the library opening. And then social and religious gatherings of fewer than 50 people. So they're still suggesting the physical distancing of 6 feet apart, cloth face coverings, encourage wash your hands, and then still trying to do things, takeout and delivery. And so I think it will be interesting. 50% capacity for other retail things, 50% capacity for personal care services. And I think we'll hear more about that. So I just thought it was really interesting, like that we've gone from real limited in restaurant and that kind of stuff, that then all of a sudden we're now going to like open the bar 25%. So whatever that means. So that will be real interesting. But otherwise, the only other kind of COVID kind of thing that I have seen, which is really pretty interesting, and maybe some of you guys caught this in the borough meeting. They are starting to do some community wide basically screenings. So I want to say today they were going to be up at Glacier View on I thought I had written it down, maybe the 12th out on KGB. So look to the borough website. They're talking about setting up basically these CERT and drive up test sites. You don't need an order. There's no fee. And so that's something that I believe the borough is doing. So that's pretty interesting. And, I think that's kind of the COVID thing. We're really fortunate in our state because the numbers remain really low. And we'll be telling what happens in the next week or so with all of this. And if we have more numbers that open up, and if we don't, I would say that just tells us our prevalence is real low in the state, which isn't a bad thing either. So with that, I want to talk for those of you that hopefully some of you are aware that I'm actually, let's see how I do this. I am on the radio on Monday mornings now going forward. And so Lee had jumped on the call this week with Mike, and I was on last Thursday as well, just talking about things about health and COVID. And Lee asked me some good questions about exercise. And so I wanted to talk a little bit more about the impact of exercise on aging and immune function. And so with that, I threw together some slides, and actually I think what's going to be really interesting for people are some of the references that I have in the end of this. And I'll again get a email out that has this in here. So in basic, kind of what happens when we move, we improve our circulation, we actually improve the function of our immune system, we reduce overall inflammation in our bodies, we're decreasing stress, and there's the added benefit of improving our cognitive function, which is great. In terms of circulation, when I think about circulation, you're thinking about all of your arteries and your veins and your body, your heart, all this basically improve blood flow with movement. And we know that by virtue of when you're sitting at rest, your pulse is lower, whereas if you get up and move, your pulse goes up. So you're pumping more blood around. That in turn increases oxygen delivery in the body, especially our brain, which is important. Delivering nutrients that everybody hopefully is eating vast quantities of right now to all of our tissues. It also aids in toxin removal, and this in turn improves our immune function. The immune system, I struggled a bit with this putting together because it's a really complex system. So to try to kind of break it down, this is a way 30,000 foot view of things, and we could dive into a lot of detail, but really we're looking at an innate system and adaptive system. Our innate system is really that first line of defense. It involves natural killer cells, macrophages, neutrophils, phagocytes, dendritic cells. These cells all respond to insults, if you will. It's a very rapid, non-specific system. We need this for fighting infections, injury response, and it's a very normal response and can go awry if it gets turned on, into a cycle. Our adaptive system tends to be that more long-term defense. It involves antibodies, specific antigens. This is kind of the system where you have an allergy to a food, something like that, and that the first time you get exposed, there's a little bit of a reaction, but then the subsequent exposures can be a worse response. This involves memory T cells. Adaptive system is involved in autoimmune disease if it gets triggered in a bit of an abnormal way. And really our adaptive system a lot of times is the focus of vaccines because we want our body to recognize things. And when you look at, like, I found a cool little picture here of basically our innate, our innate system, and that shows all those little cells. And like when I talked about on the radio, we talked about natural killer cells, and those things are really helpful when we're fighting acute infections. Natural killer cells help us in cancer care as well, as does our whole immune system. And then our adaptive immune system tends to be more antibody mediated, but this just gives you a little infographic kind of idea of what do these things look like. When we talk about our immune system, it improves with response to, actually, let me back up. So there's been some studies that look at like vaccination and when do we mount antibody responses. And this is really pertinent today because we're wondering, do we get antibodies to COVID? And we know too with vaccinations, are we actually producing an antibody response? And that diminishes as we age. And it diminishes response if you don't have a robust immune system. So exercise, we know, will improve responses to vaccines. With aging, if you remember back a little on that last slide, we tend to accumulate more of these memory cells versus lower numbers of naive T cells, which can then create new responses. These memory cells, that would also explain why a lot of times with autoimmune diseases, we see these kind of things increase with aging. And also, there's lots of studies that show us that our innate immune system is enhanced by exercise. Initially, there were a fair number of studies done in the 80s and 90s, and there's all this question about if you are exercising intensely, do you actually get immune suppressed? And they based these studies on lots of like Olympic venues, international venues where athletes would end up getting sick. And so there's lots of questions. Was it because they were there for exercise? But there were all these other confounding factors, travel, lots of exposure to all kinds of different people and pathogens, change diets and all the stress of those things. So we have since now kind of been able to do more research in, I would say, I don't know that you'd say more controlled, but not just kind of international high level athlete populations. There was a study in Wisconsin, and it was this Wisconsin Upper Respiratory Symptom Survey, and they took 1,002 adults, 18 to 85 years old, 60% female, 40% male, and it was a 12-week study of the number of days of upper respiratory infections. And so 43% lower respiratory rate infection in subjects engaging in 5 or more days a week of aerobic exercise. This was 20 minutes or longer, so not long, versus somebody who would be called sedentary at less than 1 day a week. They had 46, people that were exercising had 46% lower infection rates when you looked at that highest quartile of exercise versus lowest. So we're starting to see data shift in research that actually, and I'll talk about this a little bit more with inflammation, that even though we can tend to have maybe decreased white cells, they're now looking at that as though that's not necessarily a problem, that the white cells go down. What's happening is they're peripherally marginating, so they're actually more in an immune surveillance mode, and not so much just in your central like bloodstream when we check your blood. So this little graphic shows how our immune, we get an enhanced response against pathogens and cancer cells, and it's via these same innate immune players. And then the other inflammation part comes in with some of these complements, interleukins, and other cytokines, which can help us with inflammation, whether it causes inflammation, modulates inflammation. So to talk about inflammation a little bit, it increases with aging. The impact of sarcopenia and decreased muscle mass loss often leads to accumulation of body fat. This is more common as we age, if we're not remaining active and doing some strength training. And we know that body fat actually is metabolically active in terms of inflammation. This, I was kind of talking about, intense exercise increases inflammation and inflammatory markers. However, when you look at the resting levels in baseline in physically fit people, they have lower levels of overall inflammation, which is a good thing and what we want. So in combination, again, with nutrition, inflammation plays a really large role in our aging and in our immune response. The other impact that we can really, or other variable we can really impact is stress. Certainly high levels of stress suppress our immune system. I think about that, number one, chronically elevated levels of cortisol. We know that when people are on chronic immune suppressants, they have a higher likelihood of getting sick. Like if somebody with emphysema is on chronic steroids, potentially increasing their susceptibility to infectious diseases. I think about like steroid shots. People, I don't see it so much now, but certainly there are people that go in the spring and they get this steroid shot, a long-acting steroid shot for their allergies. Well, what we're doing is suppressing their immune system. So if we even have chronic levels of high stress, so stress at home, stress from not eating well, inactivity, all of those things, that's going to suppress our immune system. When we have chronic elevated levels of cortisol, people tend to gain weight in their belly area. It's going to increase our diabetes, heart disease risk. And that is suppressing our immune system again. Exercise in general will lower your stress, and lowering stress will improve our sleep, which is important for our resiliency, which we've talked about before, as well as our brain function. In terms of cognitive function, exercise definitely supports cognitive function via all of those mechanisms, whether it's circulation, um, inflammation, and our immune system. So those are all big players. There's benefit from aerobic and resistance training. And probably one of the bigger things is exercise causes an increase in brain-derived neurotrophic factor. Intermittent fasting can cause an increase with that. There's some data to support ketosis can increase that, but exercise is a really great way for us to increase brain-derived neurotrophic growth factors, and that's like miracle grow for your brain. So that is important, and so what the things that we can be doing to increase that are really helpful, and exercise is prime for that. As for exercise guidelines, you can see I stole this fancy slide from the World Health Organization, but gave them credit. The current recommendation is for 150 minutes a week, which is really, it is 2.5 hours of time over a week, so 30 minutes a day. For an adult, moderate intensity, if you're doing something more and getting your heart rate up higher, it can be 75 minutes, or you can kind of do a combination of both of these things. Kids should get 60 minutes of exercise every day, and some do and some don't. I guess that's where there's issues around physical education in schools or lack thereof. Hopefully kids are getting out. I mean, I have a feeling right now kids are getting either more exercise or less exercise being at home, and that's something that in the long term needs to be addressed. Certainly older adults and with poor mobility, any activity we can do to improve balance, which helps prevent falls. And if we can get even people with poor mobility active at least 3 days a week, that is really helpful. And that's one of the things I talk to a lot of people about, and that has to do with kind of that muscle loss as we age. We talk about fragility and osteoporosis and bone fractures and all of those things. And I think a lot of it is if we can really either work to maintain or build our strength, we're going to improve our balance, and we're less likely to fall, and we're less likely to break things and end up down that road with the ongoing morbidity related to that. In terms of strength, I've reviewed the key 3 with a lot of people, which is a simple squat, a chest press, and a single arm row. And if you need that, I'll make sure to put a copy of that. I think there might be one on the website, but I'll link it in the newsletter. And really important to at least 2 days a week, just use some major muscle groups. So that's why squatting is so easy. Chest press is so easy. Single arm row is as simple as that pulling up motion, kind of like starting the lawnmower kind of motion. Those are all simple things, and it doesn't have to be an extensive program. It can just be some simple things. So, push-ups on your knees, push-ups against walls, all kinds of easy things that we can do that really actually will make a difference, even though it seems so simple. This was an interesting quote out of one of the references that I had used to gather some of this. Evidence shows that a physically active lifestyle diminishes the risk of contracting a range of communicable diseases, including viral and bacterial infections. And I will there's a neat link through, I believe, the American College of Sports Medicine that I will put in the newsletter that talks about basically the importance of exercise right now with regard to COVID and our susceptibility to infections. So that's kind of all I have today. The one other thing, and I'll show you my references. So one really great reference, and I just listened to this podcast yesterday. It is this podcast on, it's called the Doctor's Pharmacy. It's Dr. Hyman's podcast. And it was a really interesting interview with a doc out of the UK on how diet is driving a lot of our adverse outcomes with COVID-19, and it really talked about exercise and nutrition, which was really um, it's imperative, as you can imagine. So that's kind of what I have today. I can see if we've got. Does anybody have questions or comments or anything? Yeah, I just really have started listening to more of Dr. Hyman's podcasts, and I hadn't done that a lot previously, but the handful that I've listened to now have been really, really good, and I think really appropriate and nice because they're focused on food and health outcomes. Really awesome. Well, I will. I guess I'll throw in the link to Big Cabbage Radio as well. And then if you guys have questions, please let me know. I guess we're kind of uber fast today, so but that's okay. It looks like a beautiful day, so I hope everybody can get outside. And if anybody needs anything, please reach out. We're here. And otherwise, we will uh, let's chat again next week. I'm thinking about moving this back to maybe 9 again. Um, I don't know. It seemed like we had more people involved at 9 a.m. So maybe I'll do that, but I'll send that out in the newsletter as well. And I think going into summer, it might be nicer if it's earlier rather than the middle of the morning when people want to get outside. So, okay, with that, everybody go get outside and actually have a happy Mother's Day. Okay, so see you guys. Have a great day.